The RCN, the nursing union,
launched an unprecedented strike.
The largest nursing strike in NHS history.
NHS nurses are striking, and in today's video we're going to be taking a deep dive and having a look at the reasons to why nurses are striking. We're going to try and keep as balanced as possible on this. Obviously it's quite a controversial topic, but I think it's really important that the general public as well as aspiring medics are kept informed as to what's going on as well. If you guys are new here, don't forget to like, comment and subscribe. Alright, let's get into it. One of the main reasons as to why nurses and other healthcare professionals are striking is because of pay. Since 2010, nurses and other healthcare professionals have actually experienced a real terms pay cut. That means that their pay hasn't been keeping up with the rate of inflation, and despite what may be happening in terms of absolute pay, it's not keeping up with inflation, which means that there is a real terms pay cut. And obviously you hear about nurses being unable to afford groceries or rent simply because their work just doesn't cover the price of the rising cost of living as well. It is worth noting that all public sector jobs have actually experienced a real terms pay cut compared to the private sector.
It's quite sad and difficult to say that it comes with no surprise that nurses are experiencing extreme burnout and declines in their mental health. On top of the staff shortage crisis, the problems that exist in the NHS today and the rolling backlog from COVID means that nurses are working for much longer than they have before and are taking on additional responsibilities on top of what they're already expected to do. And so nurses are finding themselves multitasking on a day-to-day basis and are being stretched quite thin, which is no environment for anyone to work in. On top of that, an RCN report has found that nurses are working additional hours and are not actually being paid for these extra hours. And shockingly, nurses who are called in sick are still asked to come in due to these shortages. And that's detrimental to anyone's both physical and mental well-being. A similar issue has been identified among paramedics, and a study has found that more than half of paramedics are experiencing burnout due to the unmanageable workloads, the involuntary overtimes, and the distress of not being able to reach seriously ill patients. And it's not a secret that medicine is an emotionally challenging role to be in. So adding these harsher environments and these additional responsibilities, of course they're going to be experiencing burnout and declines in their mental health, and it's completely unfair. And so nurses are striking to protect themselves, to ensure that their voices are heard, and not just for their voices to be heard, but to be compensated.
Staffing shortages is becoming a chronic problem within the NHS, especially in the nursing cohort. In fact, around 47,000 shortages have been reported this year, placing patient safety at risk, but also the mental health of the nurses. With the shortages, there is an extra amount of patients that each nurse has to look after. There's the increased burnout and stress, and there's also kind of the compromise of patient safety, and even routine procedures are having to be cancelled due to the safety risk with the lack of nurses. But it's not only nurses that are becoming affected. Since 2018, it's also been reported that 1,000 ambulance staff have left, citing reasons such as early retirement or going to jobs with that are getting paid better. So staff shortages as a whole is becoming a real problem among the NHS.
With the damaging effect on nurses, it's important to consider how patient safety is impacted. Nurses are the beating heart of the NHS, and it's not possible to function without them in terms of the care and management of patients, as they work very closely with them on a day-to-day, hour-to-hour basis. And so it's not easy for nurses to acknowledge that patient safety is in fact being compromised. We've all seen videos and pictures of ambulances being stacked outside of A&E, waiting for patients to be admitted, waiting for a bed. And due to the shortages in staff, due to the bed crisis, there are lots of patients who are waiting months, even years, to get the treatment. And it's quite alarming to see how many patients have quite poor outcomes despite the number of years they have waited. Where patient safety is being compromised, it becomes everybody's issue, and nurses are striking and advocating for not just themselves, but for better working environments to ensure that it's not just them who are able to provide a suitable means of care, but the reason for that is to ensure that patients are at the end of that to receive a holistic, patient-centered approach means of care so that they are feeling like they are heard within the NHS. They are feeling like they are getting the care that they deserve, especially when they are at their most vulnerable.
After the government turned down our last-minute offer to renegotiate nurses' pay, we had to take in our own hands and fight for our voices. As many as 100,000 nurses walked out on the 15th of December, and again on the 20th. Their voices loud and clear. They don't want to strike, but something needs to be done to ensure fair pay and save the NHS from this current staffing crisis. They waved their banners voicing the situation and asking for public support. We've clapped the NHS throughout the pandemic. Now we need your support for real government action. Thousands of paramedics also striked on the 21st of December, a day after the nurses' strike. They shared their heartening stories of having to go to food banks or approaching their union's welfare department to try and to make ends meet during this cost of living crisis. The theme is also very clear. Pay the paramedics what they deserve, have a solid recruitment plan, or there'll be no safe NHS.
On the 10th of November 2022, nurses under the Royal College of Nursing balloted to take industrial action against the NHS and to effectively strike. Since then, the government response has been quite underwhelming, and there seems to be no negotiations really taking place and no sort of compromise that's being made. So at the moment, there doesn't really seem to be an end in sight, and obviously this could quite easily change, but at least at the moment it seems that both parties are digging their heels firmly in the ground. Ultimately, these nursing strikes are about so much more than just pay. It's about working conditions. It's about the NHS long-term strategy, not only to retain, but also to recruit its workforce and ensure that there aren't these gaps in the rota as well. We've tried to approach this as apolitically as possible, but we'd love to hear your thoughts down in the comments below. And if you're new here, don't forget to like, comment, and subscribe. We offer the best videos helping you to get into medical school. All right, guys, see you in the next video.